As we have seen in our previous videos, the entire estrus or ovulatory cycle is controlled by the two key ovarian structures, the follicles and the corpus luteum, CL. Older programs primarily focused on controlling the CL, but required the producer to detect estrus in the cow to attain optimal results. These were known as programs from Synchronization of Estrus. Newer programs control both the follicles and the CL, and therefore produce ovulation at a precise, predetermined time period. Thus, these are known as programs for synchronization of ovulation. Because the producer knows the time of ovulation, all cows can be inseminated at one time, called timed AI. The classical programs for synchronization of estrus used two prostaglandin injections. At the first prostaglandin injection, cows are at any stage of the cycle. Cows that have a mature CL, older than 6 days, will respond to the first prostaglandin and show estrus 2 to 7 days later. Cows with a younger CL or without a CL do not respond to the prostaglandin treatment. A second prostaglandin treatment is generally given 10 to 14 days after the first treatment. In theory, cows that responded to the first treatment will now have a new mature CL, and cows without a mature CL at the first treatment may now have a mature responsive CL. The fundamental problem with double prostaglandin programs is that they rely on heat detection. Many cows will not be detected in heat and therefore will not become pregnant. The time of ovulation is highly variable after double prostaglandin programs because follicle function has not been synchronized. Estrus remains the only way the producers can estimate the time when the cow will ovulate and therefore to estimate the best time to AI the cow. Thus, the reason for poor results with double prostaglandin programs is that they do not provide good control over both the CL and follicles, and therefore cows must be detected in estrus to produce acceptable fertility. On the other hand, synchronization of ovulation programs use the hormone Gnrh combined in an optimal way with prostaglandin to provide greater control over both the follicles and CL. The most common form of Gnrh product contains gonadorelin acetate. Gonadorelin is an exact copy of naturally occurring Gnrh, which causes the pituitary gland to release LH and FSH. Treatment with Gnrh can cause ovulation of a dominant follicle and development of a new CL. In addition, ovulation of the dominant follicle causes growth of a new follicular wave. Thus, the first injection of a GPG program, like Opsync, can begin synchronizing both the follicles and the CL. In a GPG program, the first Gnrh treatment is followed 7 days later by treatment with a prostaglandin, such as cloprostenol. This prostaglandin treatment kills the CL, decreasing progesterone and allowing continued development of the follicle. At 56 hours after the prostaglandin treatment, a second Gnrh treatment is given. This treatment is used to synchronize the time of ovulation at about 28 hours after the Gnrh treatment. The optimal time to perform AI is at 16 hours after this Gnrh treatment, so that the sperm are present in the oviduct at the time the ovum is released. Thus, use of two Gnrh treatments, combined with a prostaglandin treatment, synchronizes both the follicles and corpus luteum, allowing for effective timed AI. Only 40 to 50% of cows will show estrus after a GPG program. This is because the final Gnrh injection starts the follicle on the road to ovulation, and therefore estrogen may not reach the concentrations in the blood that normally produce estrus. However, the use of Gnrh to synchronize ovulation eliminates the need to detect estrus in order to AI near the time of ovulation. Suppressing heat display has the added benefit of conserving metabolic energy, which ensures a consistent lactation and reduces the risk of injuries from estrus display. As you can see, the GPG program condenses the normal 21-day cycle into just 10 days, but it also enables precise control of when the cow will release an ovum so that the producer can breed all cows at a predetermined time. In other words, timed AI. Let's look at a few questions that often arise. Why do we use 56 hours between the PG injection and the Gnrh injection? This provides sufficient time for progesterone to decrease in response to the PG and for the new follicle to mature so that it will ovulate at the correct size in response to the second GnRH treatment. These two factors increase the likelihood of conception. So if we can precisely control ovulation and insemination such that there is an egg and sperm present at the same time, why don't we get 100% of cows pregnant? First, all cows are not precisely synchronized by the GPG program. The cows that are synchronized have exceptional fertility. However, newer programs have been developed that improve synchronization and fertility. Second, numerous other factors, such as AI technique, health of cow, energy state of the cow, etc., can impact fertility. Many of these factors can be particularly problematic in specific dairy farms or dairy cattle. One way that conception rates can be increased for fixed-time AI is to have more cows in the luteal phase when the Opsync program starts. This means that by the time the second GnRH is given, a large mature follicle has been produced, hence increasing conception rates. This is achieved by pre-synchronizing cows, typically by administering a double prostaglandin program 10 to 12 days before starting the Opsync program. These pre-sync programs were developed because fertility was greater in cows that started Opsync on day 5 to 12 of a cycle than in the earlier or latter part of the estrus cycle. If the full pre-sync Opsync program is completed with all cows receiving the full 5 injections over 36 to 38 days, conception rates can be increased by around 10%. However, pre-sync Opsync programs can increase time to first AI until nearly 80 days in milk, which may be much later than optimal for some dairies. As a result, producers started to cherry-pick those cows that were detected in heat after the pre-sync PG shots. Whilst this seems logical, if a cow is in heat, breed it, the improvement in conception rates to the timed AI is lost when the most fertile cows are bred to estrus rather than the timed AI. One strategy that has been implemented in many dairies is to use a simple Opsync program early in lactation to produce a timed AI at about 60 days in milk. With this approach, all cows are bred early in lactation with normal fertility. The critical message is that whatever program is used, it should be systematically and precisely implemented on the farm. This is why simpler programs, such as an early Opsync, can improve reproductive efficiency on some farms compared to implementing more complicated programs in an attempt to increase conception rates. Other researchers have used a double Opsync program in order to improve fertility at first AI. Double Opsync is simply 2 Opsync programs administered 7 days apart with the fixed time AI at the end of the second program. Unlike the pre-sync Opsync program, the double Opsync program can induce cyclicity in non-cycling cows. In addition, it can assure that all cows begin Opsync at the most optimal day of the cycle. This double Opsync program gives the best fertility in first lactation cows, but also improves fertility in older cows. Optimal breeding programs rely on accurately detecting cows that are not pregnant as early as possible after breeding, and then rebreeding them as quickly as possible. Cows can be accurately preg-checked by manual palpation around 5 to 6 weeks after breeding, and as early as 28 days after breeding using ultrasound or blood tests for pregnancy-associated glycoproteins, PAGs. In order to shorten the interval between breedings, some herds that use rectal palpation for pregnancy diagnosis will give a treatment with GnRH 32 days after completing the first Opsync program. This means that on day 39 after timed AI, when a pregnancy check is conducted, if they are not pregnant, the cow is already 7 days into the Opsync program. They can immediately be given a PG shot and a second GnRH injection 56 hours later and bred the next day after that. This assures that all cows are bred by 42 days after previous AI. In herds that use ultrasound for pregnancy diagnosis, a similar strategy can be utilized by giving a GnRH treatment at 25 days and then doing pregnancy diagnosis with ultrasound at 32 days. This program will assure that all cows receive rebreeding by 35 days after previous AI. The 7-day shorter interval between AIs using these resync programs can make producers a lot of money.